Okay, this is gonna be real quick, y'all. Um, just had a thought. Well, I've been having this thought for a while. When you are working with a therapist, or any provider for that matter, make sure that you all are the right fit. I feel like with therapy, a lot of times therapy may not work because you're just not the right fit. It doesn't mean that it's something wrong with the therapist. It doesn't mean that it's something wrong with you. It doesn't mean that therapy don't work. It means sometimes that you are not the right fit. Now, I've always been told that, say you are, let's say African American, let's put it out there. Um, Say you have a Caucasian therapist, that can work. But I get some patients that tell me I want to talk to somebody who it looks like me. That doesn't mean that they're being racist. It simply means they're trying to say they want to talk to somebody who understands them better. Um, I've had, when I was doing therapy, I've had a Caucasian therapist, um, and I've had a African American therapist, female therapist. Never had a male therapist. And both of them, I think, work for their purpose. Um, but I feel like if I had a male patient, a male therapist, I don't think it would have worked for me. Especially, say I was going to him about maybe some depression due to, I'm trying to hurry up, y'all, got patience, due to something I was experiencing in a marriage, in a past marriage, or something. I feel like he would have had a hard time um, understanding how I was feeling as a woman. Maybe not. Maybe he could have helped me understand why men think the way they think. Maybe so. Um, but that would not have been what I needed him for. I would need him to help me, to guide me, um, to on some behavior changes and how to deal with things. Like I say, therapy is different. I don't do therapy at work, but if I was to do therapist, I wouldn't be the type of therapist where I'll just sit there and just listen for you for 30, 45 minutes. That's not how I would do therapy. It's probably why they don't want me to do therapy. But I would give you homework. I think homework is good, especially if you have anxiety or depression. I might have to split this up, y'all, if my patient get ready. But write down the things that's making you, like if it's anxiety, anxious, write down the thing that's making you depressed. Learn your triggers so that you can avoid those things. Say it's this one particular family, friend, or whatever. I'm just saying that. And they get under your skin so bad, they set you off. Guess what you need to do? You need to limit the time that you communicate with them. That don't mean don't communicate with them, but instead of giving them, like, say you talk to them every day, and you talking to them 30 minutes a day, limit that to 15 minutes a day. If that don't work, limit it to 5 minutes a day. If that don't work, limit it to maybe talking to them every other day or once a week, whatever it is, to protect your mental so that you won't get triggered. Say that there are anniversary dates of um, a death, a parent, a close friend, a family, and you know that that anniversary death makes you really sad. I would tell my patients to um, allow yourself to feel that sadness, that emotion, but try to replace that date with something. Like I had a day, like my mama passed away, and that date stuck out in my head every year. I would even take off from work because on that day, because I knew I was gonna have a bad day. I had already told myself I was gonna have a bad day. I had to do something to replace that day. So now I don't take off on my mama's anniversary date. Um, do I get sad sometimes on her anniversary date? Of course I do. But I have learned to deal with that, and that's what therapy do. Um, Again, I'm trying to hurry up, so I'm bouncing all over the place. So don't be afraid to tell your therapist, I don't think we are a good fit. Maybe don't say it like that. Just say it like that. I don't think we're a good fit. Nothing against you personally. I just want to talk to somebody else who I feel like can understand what I'm going through. Another thing, I don't go through this discrimination on my job. Have I ever been through discrimination on a job? Yes, I have. I would have had a hard time going to someone who didn't look like me, telling them how I felt to be a black woman on my job. They're not a black woman. Um, and I also would have had a hard time going to a younger black woman versus somebody who's around my age, because face it, a younger person, let's just say in their 20s, has not experienced what I have experienced as a 52-year-old. They haven't experienced that. So research. I'm not gonna say research your therapist, but most people tell you a little bit about themselves. I know I tell my patients some things about me. I don't tell them everything, but I'm very transparent. I'm very transparent with my friends, with my family, with my patients. I'm not gonna tell them every detail of my life, but I tell them, like, if I'm hurt, I'm gonna tell them. If I'm happy, I'm gonna tell them. If I'm stressed, I'm gonna tell them. And I do that to let them know that I'm not too different from them. To let them know, hey, you can talk to me, you can come see me. I understand. I was gonna say one other thing, but yeah, it's not your therapist is not gonna get offended if you say we are not a good fit. Do you have somebody else that I can talk to? And tell them why. It's nothing to be ashamed of. It's just like I have different friends. You all have different friends. I know I can go to this one for this. I can go to that one for that. Very rarely do you have that one person who is going to understand everything that you're talking about. So that's why we have different people that we talk to. But with a therapist, you can't have like different therapists. You got to find that one fit. Find that fit. Don't be afraid to say we are not a fit, because the end goal is for you to get better. The therapist want to see you get better. The therapy is needed because I don't like to just prescribe patients medication without the therapy to teach you to handle certain things, to make your life happier. That's all I have for now. I gotta go. Y'all be blessed.